This is the retina session. My presentation will be the first presentation اسمها غريب شوية. Choose to wet not to dry type. سؤال بقى. مين فيكو شاف post vitrectomy macular fold؟ مين فيكو قابل المشكلة دي؟ اوكي. حاجة سخيفة جدا جدا جدا. You do an excellent surgery and then you find yourself facing this picture and this problem, which actually has a devastating effect on the vision. The retina is flat, but the vision is very poor due to the macular fold type. ايه اللي بيخلي الماcular fold happens? Well, there are certain risk factors. Most of these patients have an upper bullous retinal detachment, and you use PFCL to flatten the retina وتعمل PFCL air exchange. وبعدين the retinal detachment has involved the macula or the fovea, or ساعات بيبقى فيه كمان a small fluid. هنوريكم دلوقتي ازاي the periphery of the retina. Usually the retina is not completely flat. Fluid ده بينزل لتحت and it involves the fovea. And again, a very important thing is the improper positioning. احنا فاكرين العيان اللي عنده upper bullous retinal detachment وعملنا له جاس لازم يقعد. This is actually wrong. ايه اللي بيحصل؟ الحقيقة زي ما انتم شايفين هنا. We fill the eye with PFCL. بيحصل قدام هنا هو in subretinal fluid is the periphery here. It's entrapped. وبعدين بنعمل fluid air exchange. بيفضل شوية fluid كده. الفلويد دي تقوم نازلة and is being entrapped in the foveal area and causes the foveal macular fold, which is again a very nasty problem. طيب هو اللي أنا عايز أقول لكم how to deal and how to prevent this. The prevention is the most important thing. طبعا how to deal with the foveal or the macular fold ده شغلانة تانية خالص. دي مش this is not the topic of my talk. How to prevent. Number one is the supine position. العيان اللي عنده upper bullous retinal detachment and his gas filled زي ما قلت لكم احنا فاكرين ان العيان اقعد. لا. The best position actually is to have the supine position. العيان بيقعد على ظهره and actually the bubble is up. and على فكرة the bubble will also support the peripheral breaks and what I call partial saline filling. وده اللي هوريكم. This is an upper bullous retinal detachment. وهنبص مع بعض كده احنا بنعمل ايه. This is a typical picture. يعني عملنا PFCL, flatten the retina, where the retina is being flattened now. I'm removing all the PFCL from the back of the eye, and in a moment you'll see what's going to happen. بصوا نون. أنا بشيل كل ال PFCL from the eye. Type. This is a foveal fold. ليه؟ لأن الفلويد from the periphery went down and it's being entrapped here. طيب هعمل إيه؟ Fill the eye with saline again. Choose to wet, not to dry. Don't insist on leaving the eye absolutely dry. This is wrong. So choose to wet, not to dry. عيان تاني هو. Again, the upper bullous retinal detachment. And this is the عيان عنده buckle وزي ما انتم شايفين كده هو. اوكي. I flattened the retina. شلنا كل ال PFCL. نوصل لهون. Sorry. معلش أنا آسف. العيان اللي بعديه. Again, another patient here. Flatten the retina, the PFCL. Remove the PFCL completely. ده للناس اللي بتستعمل PFCL. في ناس ما بتحبش تستعمل PFCL تستعمل air alone and they try to remove the subretinal fluid from the break. Again, wet the retina. If you find that the macular fold which you see, which you have to do the procedure under vision, if you are not able to flatten this macular fold with the saline, just again fill the eye completely with saline and then inject slowly gas. So at the end here, choose to wet, not to dry. ثانية واحدة، لحظة واحدة. Choose to wet, not to dry, and this is the take-home message. Macular folds have a devastating effect on vision. Prompt surgical intervention is recommended. Visual outcome is not satisfactory even if you flatten the fold, and prevention is the way to go. And this is a very important paper which I urge you all to read because it explains what happens. And finally, I just remind you of our next EVRS meeting, Shahr Gay, and thank you very much.